Okay, so we had OCD as our psychological disorder, and this is a type of anxiety disorder.
We have a video just to show a quick overview of what it's like.
That's when you wash your hands a lot, right?
Oh yeah, I think I have OCD too.
You're just careful.
I get it. I'm totally obsessed with keeping my closet organized.
Everyone has anxiety.
Sometimes I double check the stove.
I mean, I like to be clean too.
OCD is far more complex than people think. It's more than keeping things in order. It's more than counting. It's more than just washing your hands. And it's far more than just double checking. 1 in 100 adults in the U.S. is affected by OCD. And of those, 50% of those cases are considered severe. OCD is a more common disorder than most people think. 3 million adults in the U.S. suffer from OCD. Compare that to the 3.6 million with autism, 3.1 million with breast cancer, 1 million with AIDS or HIV, 1 million with Parkinson's disease, and the 400,000 with MS. To many, it is often shocking just how prevalent OCD is. In addition to many adults who suffer from OCD, there are many children who suffer with the disorder. It is estimated that 1 in 200 kids and teens have OCD. That's the same number of kids with juvenile diabetes. There are 2 general age ranges when OCD first appears. Usually it's between the age of 8 and 12 years old, or between the late teen years and early adulthood. Unfortunately, it often takes far too long for those with OCD to be diagnosed and properly treated. Studies find that it takes an average of 14 to 17 years from the time OCD begins until the time a patient receives appropriate treatment. The best treatment for OCD includes, first and foremost, exposure and response prevention, or ERP, as well as a trained therapist, medicine, and family support and education. When these 4 treatments are used together, it is very possible to manage one's OCD. As awareness for the disorder increases, it helps those who suffer to get diagnosed more promptly and to gain access to the treatment that they so desperately need and desire. The more we talk and educate, the more understanding and help OCD sufferers and their families can gain.
Obsessive-compulsive disorder is a common chronic and long-lasting disorder in which a person has uncontrollable, reoccurring thoughts, obsessions, and behaviors, compulsions, that he or she feels the urge to repeat over and over.
So some of the signs and symptoms, OCD is made up of both obsessions and compulsions. So obsessions are repeated through urges or mental pictures that cause anxiety to a person, and some of these signs and symptoms are having fear of germs or contamination, thoughts of harm, aggressive thoughts towards family, friends, self, or strangers, and having things symmetrical or in a perfect order all the time. And compulsions are repetitive behaviors that a person with OCD feels the urge to do in response to an obsessive thought. So excessive cleaning and or hand washing, ordering and arranging things in a particular way, repeated checking on things, such as repeatedly checking to see if the door is locked or if the oven is off, compulsive counting, and other things that are not considered obsessions or compulsions. They can't control his or her thoughts or behaviors, even when those thoughts or behaviors are recognized as excessive. They spend at least 1 hour or more a day on these thoughts or behaviors. Doesn't get over the thought when performing the behaviors or rituals, but may have brief relief from the anxiety through cause, and experiences significant problems in their daily life due to these thoughts or behaviors.
So this is going to be a story about Harlan Kirschenbaum, and he was controlled with OCD for 13 years, and so this is his story.
What I would do was basically, if I had to touch it to go like that, I would make sure the time was right, and then I'd be like 1, 2, 3, 4, 5, and then like, oh no, like a bone crack or something, or I'm itchy, so now I gotta do it again. So 1, 2, 3, 4, 5, and now that's 2 times I did it, but 2 is a bad number, so now I gotta do it 3 times, so 1, 2, 3, 4, 5.
Harlan Kirschenbaum describes just one of the rituals that used to rule his life. For 13 years, he lived with an extreme case of obsessive-compulsive disorder, or OCD. It's a chronic psychiatric condition that has 2 main symptoms: obsessions, or intrusive unwanted thoughts that can't be pushed away, and compulsions, often called rituals, which are repetitive behaviors done to reduce anxiety.
My 2 obsessions are death and cancer, so I would come up with all these like crazy rituals. Like if I touched a wire, then I would think my brother would get cancer because of it. And everything morphed, and I got more and more rituals as time went on. And every day it seemed like I was adding a couple. I was housebound, and I couldn't do anything for myself anymore.
At the height of his illness, Harlan had more than 100 daily rituals and couldn't touch or look at his family members.
I had thoughts like all the time of just like, driving into a wall or just anything, because I couldn't do it. It just took all my energy out. Like I'd be crying in public, and 30 years old, and I'm sitting there crying because I saw a traffic light, and now I think that I'm gonna give somebody cancer because of it.
Dr. Peggy Richter is head of the Frederick W. Thompson Anxiety Disorder Center at Sunnybrook Health Sciences Center, one of the few specialized centers in Canada dealing with OCD.
There's a threshold at which point we call it a disorder that merits a diagnosis, and that is when the symptoms waste about an hour or more of the day, cause significant distress for the individual, or get in the way of their ability to function.
OCD is extremely common, affecting about 1 in 40 people. And while research is ongoing to fully understand what happens inside the OCD brain, Dr. Richter says it is a treatable condition.
There are 2 major forms of treatment: cognitive behavior therapy, which is a form of talk therapy, and medication, both of which can be very helpful to the illness. So a good starting point is to see one's family doctor and get a referral to a specialized anxiety treatment center if possible.
Both of these approaches worked for Harlan, but because his OCD was so severe, he also underwent an intensive 3-month inpatient program in the U.S. Harlan says treatment gave him his life back. He can now function without rituals and is able to hug his mother again, something he wasn't able to do for 10 years.
And I grabbed her and I gave her such a hug, and it's like all those thoughts, I beat it. I beat it, and she was crying. I was like laughing, but like a crying laugh, and it was incredible after all those years, and it felt so good.
He now urges others to get the help they need.
You gotta be fully committed, or else it won't work. And it's scary, and it's a lot of hard work, and there's lots of up and downs. But once you get there, it's just amazing.
With Sunnyview, I'm Monica Mattis.
The causes of OCD aren't fully determined, but these are some of the theories scientists have made. Compulsions are learned behaviors which become repetitive and habitual when they're associated with relief from anxiety. OCD can also be due to genetic and hereditary factors. Chemical, structural, and functional abnormalities in the brain can be the cause. Distorted beliefs reinforce and maintain symptoms associated with OCD, and you can also develop OCD if you have experienced stressful life events.
So some statistics, on average in the United States, about 1 in every 40 adults has OCD, and in children it's 1 in 100. And according to the World Health Organization, OCD is one of the top 20 causes of illness-related disability worldwide for individuals between the ages of 15 and 44.
Some of the history and background: while OCD did not get its name till the 20th century, the cases have been dated back to as long as people have been alive. This disorder used to be known as scrupulosity. Scrupulosity was common when people had obsessional fears about the religion they were in, and this was the time a new word for obsessions and compulsions came into use. For example, people had an obsessive concern for one's own sin and compulsive performance of religion devotion to now where it is all obsessions and compulsions, including daily rituals and fears.
Some typically treatments are used with medication and or psychotherapy. Medication helps reduce anxieties that are associated with OCD, and the two most common are SRIs, which is serotonin reuptake inhibitors, and SSRIs, selective serotonin reuptake inhibitors. And psychotherapy can help reduce compulsive behaviors. CBT is the most common one, cognitive behavior therapy, and that's done with a therapist, but you have to be very careful in choosing a therapist that's been trained to do CBT. For someone who has a family member that has OCD, these are some guidelines that can help you in dealing with them. So recognize the signals, modify your expectations, remember that people get better at different rates, avoid day-to-day comparisons, recognize small improvements, create a supportive environment, set limits but be sensitive to their mood, support taking medication as prescribed, keep communication clear and simple, separate time is important. It has all become about OCD. Keep your family routine normal, be aware of family accommodation behaviors, and consider using a family contact. And this is our Works Cited.